Good afternoon, everyone. After 2 vaccine talks, this third one, I'll try to keep myself, as short and crisp as possible. So we already have a robust national immunization program in place in our country. This immunization program was launched in India in 1978 as EPI, that is the Expanded Program of Immunization. It gained momentum in 1985 and UIP was launched by Government of India in 1985. At present, under our national immunization schedule, we are covering our infants and children against 11 diseases, which are diphtheria, pertussis, tetanus, polio, measles, tuberculosis, hepatitis B, rotavirus, rubella, Hib, and pneumococcal. So all of us are very meticulously following this national immunization schedule, and according to this, up to 5 years, people are very meticulous, but after that, you usually miss the 10 years and 16 years booster. And about pregnant women, no doubt, we have a robust program and all the pregnant women are vaccinated in our country. So then Indian Academy of Pediatricians recommended routine use of influenza, typhoid, hepatitis A, varicella, papilloma virus and Tdap in the routine vaccination program. But again, mind you, this is not in the government program. But I remember my children are 27 and 24. They are vaccinated against all these vaccines. So it was in place many years ago, but it's still not in our national program. So now we have two groups of, when adolescents or adults come to us, we have two groups. One, those who have only taken national program vaccinations. Those are the group where is the importance of adult vaccination. Second is this group who have taken most of the vaccinations, very few are left. So we are never too old to get immunized. And unfortunately, adult vaccination is the most neglected part of our healthcare system. It's a fraction, if I say, to be precise. So why we are talking about adult vaccination? Because there are certain vaccines whose immunity is waning after certain years. Then as we grow up, there are certain associated disease, comorbidities which are coming up. Then as we are able to cover most of infants and children with many vaccine preventable diseases, these are resurfacing in adults as diphtheria. So that is why adult vaccination is very, very important. And when we add adult vaccination to our health program, what we are actually doing, we are preventing many vaccine preventable diseases, morbidity, mortality. And one interesting point I found about this, we are actually preventing this antimicrobial resistance. Because we are able to prevent diseases, we are able to prevent infectious diseases, and we are also promoting healthy aging. So, but what are the barriers? Why we are still not able to achieve that? Because we are, because there is low awareness among public and even in the doctors. There's community preferences. Many communities, they don't even want to go for vaccination. There's vaccine hesitancy and fear, not only in general public, but at the same time in our colleagues as well. And I think this is the most, sad part. Then we have lack of dedicated adult vaccination center. Then there are resources constant. And then lack of national guidelines, which we still do not have. So what do we do? See, India is going very big about the adult vaccination program, and the the Goa Institute of Management has recently launched a national project to improve adult vaccination in September 2025. And it talks about increased awareness. Make public awareness campaign as similar to childhood national immunization program. Integrate adult vaccination into routine care. There's a push to integrate adult vaccination into travel consultant, university health checks. आजकल सबके बच्चे abroad जाते हैं इंडिया में, they're asking for immunization record. So that is, motivating parents to get themselves, at least keeping the records in place. And then it should be included in corporate wellness programs. सबके होते हैं health checkups होते हैं. This should be a part of corporate health wellness program. Then training. Training primary care physician is very important. I have had several number of cases. I recommend a vaccine. My patient goes somewhere. Madam, हमारे primary doctor ने बोला, family doctor ने बोला, ये तो आपको जरूरत ही नहीं लगाने की. Around HPV के लिए, Pap smear के, क्या जरूरत है? आपकी एज तो निकल गई. So यहाँ पे हमारा सबसे जो gray area है, it is there, and there we need to focus. Then insurance, it is not covered in insurance. If we make the vaccines covered in insurance, it's probably going to change the scenario. Then creating more standalone hospital or clinics where the focus should be on adult vaccination. As we have PCO clinic, menopause clinic, why can't we have adult vaccination clinic? Yeah, then focus on high-risk groups. Special attention should be paid. These days, a lot of adults and adolescents are having comorbidities. Those are the special group where these vaccines should be promoted. Now, this is a very important slide. I was talking about this. These are the latest recommendations by Indian Academy of Physicians published in September 24. This is a busy slide, but what I mean, anybody can download it from the net and we can go through it. Here it talks about what should be done, what are the vaccinations which should be given to all the normal adults with the normal immune system, what are the vaccinations which should be given in specific circumstances, what is to be done if you are already immunized, and what is to be done if they are not immunized. So for example, DPT, if we have taken complete course of DPT, just one TD every 10 years, and any of the TD can be replaced with Tdap once in a lifetime. If you're not immunized, which is less likely these days, then you are supposed to take the entire 3-dose schedule and follow it with the once in 10 years. Then about the MMR, ma'am, those who are immunized, it is not recommended. अगर आपका बचपन में immunization हो गया है, it is not recommended, but we do check the antibody titer in pregnant women, MMR का and इसका तो हम लोग check करते हैं varicella का, and if anti मैम ये रिसेंट रिकमेंडेशंस तो इसमें ऐसे कोई मतलब मैंने और तो कुछ नहीं पढ़ा इसके बारे में. These are 24 की published recommendations. These are not the guidelines, these are recommendations. So इसमें ये था कि अगर those who are immunized, no need to take, but those who are not immunized, they are supposed to take. Similarly, influenza we have just discussed, 1 dose every year, every 1 blanket. Pneumococcal, even if you are immunized, you have to take single dose after 65, which Dr. Renu just mentioned, and non-immunized, of course, you have to take. Varicella, again, who are already immunized or who had chickenpox, you have to check for the antibody. If not, if it is negative, you take it, otherwise you don't take it. And for unimmunized, of course, you have to take it. Then, of course, human papilloma, we have discussed a lot. I don't want to go in detail. Zoster, again, Dr. Renu has discussed. Now, then there's a group, there are certain set of vaccination which are required in the special situation. This again, Dr. Renu has discussed in great detail. I don't have to comment on that, but yes, in specific condition, in specific high-risk individuals, these are recommended hepatitis B, A, even if they are previously immunized. And meningococcal, there's a difference in dose, like meningococcal, immunized single dose, non-immunized 2 doses. Similarly, Hib in high-risk, people having high-risk category, traveling to endemic areas. So these are very specific situations. And this table, this not only tells about the doses, the route, but the brands as well. So this is a very important. Those who want any detail can go through this table. Then the typhoid, varicella, Japanese encephalitis, polio, rotavirus. Here I would like to tell about typhoid is a very important vaccine. Even if those who are immunized, it is important to take booster every 3 years. And those who are not immunized, they have to take 3 doses of typhoid oral or 1 dose of IM vaccination. Varicella, again, same, if antibody titer is not there, you have to take it. Japanese encephalitis is not a routine, but even those who are immunized and in certain endemic area, single dose and booster dose may be given every year. And yeah, the polio about the IPV, even those who are immunized, they are supposed to take single dose of IPV, adults. And those who are not immunized, they are supposed to take the entire series. Rotavirus is not routinely recommended for adults because it is primarily a disease of children. Then about certain specific vaccinations, I think I don't have to talk. Dr. Renu has already talked about these things in detail, but yeah, hepatitis B is important for us. Here it is important for, we doctors, we may be exposed, and as ma'am said, lab people, doctors, we should be careful about this thing. Then Hib, meningococcal, pneumococcal, out of this, meningococcal is important for healthcare workers. Rest are like for specific conditions. Influenza, we have just discussed in detail every year, everyone blanket treatment, no ifs and buts. Then TD, again, we have discussed in detail. Tdap, we have discussed in detail. I don't have to discuss these things again. MMR, again, we have discussed. This is specifically important for college students, healthcare facility worker, international travel. MMR is important for us. Then HPV, all of us discussed multiple times. So the IAP, the recommendations are, the vaccines required in healthy adults are only 2, DPT and influenza. Rest of the vaccines are specific to certain groups. Recommended for high-risk individuals, A, hepatitis A, B, meningococcal, varicella, Hib, typhoid, rabies, and cholera, Japanese encephalitis, depending on the specific group. Now, what are the recommendations for us? Influenza, yes. Tdap, yes. Varicella chickenpox, depending on the requirement. MMR, depending on the requirement. Meningococcal, as per the requirement. About the hepatitis B, as ma'am said, we should check our anti-HPS, and the value should be at least 10 million international unit per ml. If we have that kind of antibody titer, we are safe for next 22 years. But if you're not, like just ma'am said, sir was not having enough titer, then probably we have to repeat the doses. And but it's only repeated testing is required only for people who are immunocompromised or healthcare professionals like us, or who need, or HIV positive dialysis patient. Those are the categories who require testing. Otherwise, for a normal person, there's no need to check it again and again, and not even need to repeat a booster. Now, what do we do if a woman comes to us for pre-pregnancy counseling? What are the vaccinations you're going to offer? HPV, yes, provided she wants to avoid pregnancy for at least for 2 months. You can give 2 doses 1 month apart, and you can ask her to plan pregnancy. Influenza, yes, of course you're going to offer. MMR, yes, you're going to check the antibody titer and going to give your patient. Varicella, yes. Now, hepatitis A, B only in the high risk category. Meningococcal, pneumococcal only if indicated. So these are for the pre-conception counseling. Now, what if the woman comes in pregnancy? We just discussed Tdap, influenza, tetanus, diphtheria for everyone. Yes, but mind you, even hepatitis A and B can be given in a certain high-risk categories. देना ही है, और वैसे तो इसका अक्टूबर नवंबर का यूजुअली या अप्रैल का है, बट अगर आउटब्रेक है, एनी टाइम कैन बी गिवन. After pregnancy, if your patient has taken all the vaccines during pregnancy, then nothing is left after pregnancy. But yes, if your patient has not taken, then you can offer her HPV, influenza, we just discussed, even Tdap, MMR, depending on the requirement, everything can be offered. So our Honorable Prime Minister has a vision for our country. He wants to have a Viksit Bharat. Let's do our bit. Thank you very much.